I was discussing with a friend and he told me a story. She started studying at the University of Bamenda and decided to do nursing. A friend asked her what she was going to study and she said nursing. That friend told her that when someone asked her what she's going to study, she should just say medicine. I was like, what is happening? What differentiates nursing from medicine from the public's perspective? Before I continue, I'm Steven Elvis, and we come here every day to discuss issues of relevance to health in Cameroon and Africa. And today we are on for a special edition, which is going to look at the brand of nursing, what nursing portrays to the public. Remember, nurses are the core of each healthcare system internationally. Nurses contribute the highest proportion of the health workforce in each health system. The WHO's Director General put it very clearly: nurses are the backbone of each healthcare system. Nurses not only treat and cure diseases, but they respond to the mind, the body, and the spirit. Nurses are therefore trained to take care of individuals, taking into consideration their social status, and that brings us to the holistic approach that nurses put into place in taking care of patients. We find out that the public representation of nursing as a profession in Cameroon and most of Africa or sub-Saharan Africa is kind of blurred. When you go to study nursing, your family members will prefer to call you doctor instead of a nurse. Even your friends prefer to call you doctor. You even see that even the people doing nursing, they cannot articulate clearly the values that nursing brings to the healthcare system or to the public. Let's take an analogy of branding of different cars. When you go to purchase a car, you are looking at those qualities, you are looking at the values that each car brings forth. They are able to communicate some values about the car in the market. If you look at what we call generally Toyotas with four-wheel drives, most people will always go in for those type of cars in Cameroon and most of Africa, taking into consideration the nature of our roads, because these cars are able to go anywhere at any time. There is that mental representation of these cars with the values that they bring forth. So the question we want to ask ourselves is this: why is nursing not having that particular value? Why is it that in the healthcare industry, nurses want to be attributed particular values that are not of the profession? We nurses cannot articulate clearly the values of nursing. And because we cannot articulate clearly the values of nursing, some people sitting somewhere take advantage of this gap that we create by not articulating clearly our values. We cannot make the public know exactly our values. My grandfather could not make it clearly that I was doing nursing. And he used to tell me every time, Steven, my dream is to see you become a doctor. That tells us the mental representation of who a doctor is. Unfortunately, there is no mental representation of who a nurse is. There are people sitting somewhere waiting to fill these gaps that we've created by not articulating our values. And that's why you see the chaos we have. For example, in Cameroon, you don't know who is saying what in terms of nursing. Is it the Ministry of Public Health, the Ministry of Higher Education, or the Ministry of Vocational Training? What exactly do they want to portray in terms of nursing to the public? They are setting this confusion. This confusion comes up, and because of this, even us nurses, we cannot differentiate what HND is, what nursing assistant is, what state registered nursing is, and even what a bachelor's of nursing science is. Therefore means that there is a huge gap. We are not able to brand what nursing is to the general public. Nursing continues to be represented in the public's view. We cannot even sell it. There is this confusion even within the profession. And because of this confusion, every other person is confused as to what nursing is. And that manifests itself in the care that we give to our patients, because we don't know who is doing what. So this discussion today is just coming for us to look at how we represent ourselves and how we expect others to represent ourselves, and who is responsible to represent us nurses. We have to take the bull by the horn to say these are our values, and these values belong to the nursing profession. We as nurses have to take leadership roles. We have to be equal partners in the delivery of care. From the qualities, the values we want others to see us. So tell me in the comment section what you think about branding of the nursing profession. How are we going to, as nurses, brand ourselves with unique values that represent us as nurses? So once more, thank you for being part of Africa Health Insight. Stay connected by subscribing to our channel and be updated with subsequent videos. Bye-bye.